This is the photograph of the patient having Cushing syndrome. Now, what is Cushing syndrome? It refers to the group of clinical conditions occurring due to prolonged and excessive levels of glucocorticoids. This is the photograph of the patient after treatment. Now, causes of Cushing syndrome. They are divided into two groups. Number one, that is ACTH dependent Cushing syndrome, and second, that is ACTH independent Cushing syndrome. ACTH dependent Cushing syndrome, the causes are hyperactivity of pituitary gland that is seen in the pituitary tumors. Ectopic ACTH is produced in case of carcinoma of lung. Excessive ACTH secretion that is also seen in case of hypothalamic disorders, and excessive ACTH treatment that is iatrogenic cause. Second group of cause, that is ACTH independent Cushing syndrome. Here the cause is adrenal. Tumor of adrenal gland increases glucocorticoid secretion and that results in Cushing syndrome, as well as excessive glucocorticoid administration as a drug, and that is iatrogenic. Now, characteristic features of Cushing syndrome. They are moon face because of fat collection, buffalo hump that is also due to collection of fat at the upper back. Person is having truncal, or it is also known as centripetal obesity, that is due to redistribution of body fat from extremities. Also, the person is having purple stria or cutaneous abdominal stria, or they are also known as livid stretch marks, that is due to catabolism of protein and excessive stretching of the abdominal skin. Person is also having muscle weakness and backache due to protein catabolism. Sodium and water retention may cause weight gain, edema and hypertension. Another clinical feature, that is hyperglycemia. It is due to inhibition of the peripheral utilization of glucose, which is the action of glucocorticoids, and also there is increased gluconeogenesis. So the person is having glycosuria and diabetes, and this diabetes is insulin resistance, which is also known as adrenal diabetes. Other clinical features, that is hirsutism, facial hair growth, as well as the person is having menstrual irregularity. The patient is susceptible to osteoporosis and bone fracture, that is also because of protein depletion and bone resorption. The patient is susceptible to infection, that is due to immunosuppression. Skin becomes black, and that is due to pigmentation because ACTH has MSH like effect. Blood picture shows eosinopenia, lymphocytopenia, basopenia, neutrophilia, polycythemia and increased platelet count. CNS symptoms, they are euphoria, restlessness, excitability and insomnia. Adrenogenital syndrome. Causes are tumor of adrenal cortex which secretes excessive quantities of androgen. Also, it is due to enzyme deficiency which causes excessive secretion of adrenal androgens. Clinical features. In prepubertal male, there is early onset of puberty and development of secondary sexual characters like enlargement of penis. In females, signs of virilism seen, and they are like beard development, masculine distribution of hair, deposition of proteins in the muscle that results in muscular development like male, much deeper voice and occasionally baldness if genetic background is there. There is also enlargement of clitoris, and excessive libido. Now, disorders of parathyroid gland. Tetany. It refers to a clinical condition resulting from increased neuromuscular excitability. Causes of tetany. They are hypocalcemia. When concentration of ionic calcium is reduced to less than 50% of normal that is 9 to 11 milligram per deciliter. When this level is less than 50%, cell membrane of the neurons become more permeable and that results in series of action potential. Another cause for tetany, that is hypomagnesemia, and that also causes tetany because magnesium ions are also associated with neuromuscular irritability. Another cause for tetany is alkalosis, which reduces ionic calcium and can produce tetany. Clinical features. Tetany may be latent or manifest. In manifest tetany, one of the important symptoms, that is carpopedal spasm. Here you can see this is the photograph showing carpopedal spasm. The hands in the carpopedal spasm adapt a peculiar posture in which there occurs flexion at the metacarpophalangeal joint. You can see here metacarpophalangeal joint, there is flexion. Extension at the interphalangeal joint, here this is extended, and there is apposition of thumb, you can see here. This peculiar posture of the hand is also known as obstetric hand. Other clinical features of tetany include laryngeal stridor, that is loud sound results from the spasm of laryngeal muscle. It may produce asphyxia. Also the person is having convulsions and even death. Other features include intestinal cramps, biliary spasm, bronchospasm, profuse sweating, and they are due to increased excitability of autonomic ganglia. As well as there is paresthesia, tingling sensation in the peripheral parts of the limb or around the mouth. Next is latent tetany, that is also known as subclinical tetany. Here, above described typical symptoms as well as signs of tetany, they are not present, but these signs can be unmasked by following provocative tests, and they are: first, that is Strauss's sign. Here, blood flow to the limb is occluded, you can see here, by inflating the cuff of the sphygmomanometer above systolic pressure, and that is occluded for about 3 minutes. It produces characteristic carpal or pedal spasm depending on the limb tested. Another provocative test is Chvostek's sign, and it refers to tapping of the facial nerve at the angle of jaw that results in twitching of the facial muscle. That is also due to increased excitability of the nerve by mechanical stimulation. Also, in patients with latent tetany, voluntary hyperventilation can bring about tetany by producing alkalosis.
Thank you.